Hari Prasad grew up in Madras, India, and he moved to a small town in West Virginia to go to school at age 19. From there, he focused on healthcare economics and held a series of jobs where he analyzed the patient journey and created the infrastructure for success under accountable care. But the idea for Yosi Health came from his own personal experience. After dislocating his shoulder, he had the very painful experience of filling out all sorts of paperwork before he could be seen at the doctor's office. Ouch! Yosi, which means awareness or think, was created to improve the front-end experience for patients and providers. The results, reduced patient no-shows, higher collection rates, and improved online reputation, are attractive to practices that generally provide great care coupled with pretty poor customer service. Hari is rereading Shoe Dog, Phil Knight's autobiography about the creation of Nike, and he's finding many valuable lessons there. I'm David Williams, host of the Health Biz podcast and president of Health Business Group, a strategy consulting firm that helps companies like Yosi develop robust growth plans. Reach out to me, dwilliams@healthbusinessgroup.com, if you'd like to discuss strategy for your company. While you're at it, please subscribe to the Health Biz podcast on your favorite service. Well, Hari Prasad, founder and CEO of Yosi Health, welcome to the Health Biz podcast.
David, thank you for having me.
Yeah, I'm looking forward to hearing about Yosi, but before that, I want to hear about your path to getting there. Maybe starting with your just your background, your upbringing. What was your upbringing like, and any big childhood influences that have stuck with you?
Yeah, sure, David. I grew up in India in a town called Madras. It's one of the largest cities in the country, so packed with action. It was a diverse place where you get to meet a lot of people. I lived there until I was 19. I moved here when I was 19, and I currently live in New York City. So there's a lot I can relate to where I grew up living here in New York City.
No, that's nice. I have a son who's 19 right now, and he's actually doing a year abroad. So it's a very, important time in your life where you're just becoming
You
an
will
adult.
absolutely look back at this experience and be very thankful for it.
Yes. No, I think so. Well, good. So
Yeah.
you're a big city type of person. When you refer to Madras as a town, I know you're a kind of urbane person if if that's a town, because that's a big one. Good. And then what did you study? Were you a good student, and what did you do in school?
Yeah, sure. In terms of the influences, there's a lot of people and factors. Firstly, my parents, right? I found out how deeply they cared and how affectionate they were towards their children. That was a big part of my growing up. And then I had two older siblings that were extremely smart, so it was easier for me to look up to them. And being the youngest in the family, it also allowed me to get away with a lot of things growing up. So I was able to do a lot of things on my own, explore things, and not worry about the consequences about landing in trouble. So that played a big part eventually in the future. And then I changed schools pretty often, which meant I always had to make new friends pretty quickly.
Yeah.
In hindsight, I was fortunate now that I have a lot of friends that I made over the period of time.
It's interesting. Birth order is one of those things that's kind of fascinating as well. My wife and I are both first children, so we relate, I guess, in that way. And we have multiple kids, and they seem to be. I think you're right. That one theme is certainly that, like the last one is like, you can get away with a lot. I felt like my younger brothers got away with a lot, that my parents wouldn't have allowed. And maybe the parents become better and a little more relaxed over time. I don't know.
Right. They hopefully got better with us as well.
Yeah.
That's what I say.
Yeah, that's good. So, and then when it came to what you wanted to study, did you always know kind of what you wanted to do and where you wanted to go to school?
Yeah, I went to school for an engineering program in India. I studied there for 2 years. I was a pretty good student, not on the top of the class, but not at the bottom of the class either. But then when I was 19, I had an opportunity to move here as a transfer student to finish my undergrad program. So I moved here as a junior, and that transition was exceptionally interesting. Coming from a big city in a different country to a small college town in West Virginia. It was a fascinating journey. I had an amazing time there, met a lot of great people, Graduated from there and went on to complete my master's program here in healthcare informatics.
I can imagine you get to West Virginia from India, you're like, where is everybody?
Right. From being in a place with tens of millions of people, now you're in a college town, you land there on a weekend, and the place was completely shut down. So
Yeah,
it's a
yeah,
fascinating experience to explore the place by your own, and it makes for a great adventure, both
yeah.
meeting new people and the place in itself.
So it sounds like you went right into healthcare from a studies standpoint, and then a lot of interesting early career work in healthcare. Can you talk a bit about your journey, as you left school and went into the working world?
Yeah, after I finished my graduate program, I started my career with United Healthcare as part of their medical economics team, which was a newly formed team in a fast-growing plan that I was part of. And our goal was to be at the intersection of care and see how the economics impacted the care that we deliver to the members. So it was a fascinating place to look at a lot of data, be in the front seat of helping understand the business more deeply and also helping our leaders make the right decisions at the right time. So I was fortunate that I was part of a large team of medical economists that were looking at the data to help drive their decisions. And from there, I went to AmeriGroup, which is now part of WellPoint. And part of my role was to create the infrastructure there to once again use data science to help identify the right care that we could provide for the members that we served, which often meant we had to identify members before an adverse event happened. So a lot of the things that we did was pretty cutting edge in terms of identifying the high-risk members, making sure that they were receiving the right care, not in a hospital or inpatient setting, but in their community, in their primary care office, and in their specialist visits. So it was great for me to understand healthcare from a bird's eye view in terms of how care that's delivered to members at the right time had a big impact on the overall economics of our industry.
Great.
Yeah, and from there, I was recruited by the founder of a radiology benefits management company to help oversee their services that they were offering to payers. And then after that stint, I was fortunate that my timing was extremely great in terms of the opportunity to work at Montefiore Medical Center, which is a large health system here in New York. It's an integrated care delivery system where we took the financial risk for the patients that we served, which meant, unlike a fee-for-service model, we also had to look at the holistic view of a patient, making sure that we were providing care for our patients and also managing our financial risk. And our team was leading the efforts in making Montefiore the first pioneer ACO program in the country back then in 2011. So I was also once again fortunate to have the front seat to work directly with CMS and a number of other state agencies as they were thinking about the accountable care organizations and how to even think about even creating the success measures of what these ACOs were supposed to be doing. So a lot of the early work that we did was coordinating directly with the CMS program and instituting the ACO program within the organization. And by the time I left Montefiore to co-found Yosi, Montefiore was the most successful pioneer ACO in the country at that time.
Great. So it sounds like right place at the right time for a number of these opportunities, and you really made the most of it. So that's a terrific story. So now we bring us up to where you currently are at Yosi. Now, I would like to understand about kind of why you helped to start the company, and also sort of I want to say, like, what is Yosi? I feel like I'm talking about a person. Like, who is Yosi?
Right. Yeah, so I told you about where I grew up in, and in the vernacular, Yosi literally translates to awareness or think is what it translates to.
Yeah.
So we like the idea of bringing that into healthcare, and that's the reason behind the name Yosi Health. And in terms of why we started the company, having spent over 12 years in healthcare prior to Yosi Health, it was really a personal experience that motivated me to start the company. I dislocated my shoulder and I went to an ER with that dislocation. And I sat there and I had to fill out a bunch of forms, waiting for the shoulder to be put back in.
Yeah.
And at that time, I had access to zero of my medical information. I had no idea where my insurance cards were. None of my medical records were accessible. So I left that experience thinking, what are providers thinking about the front office experience? Because if, as a consumer that spent a lot of time in healthcare, if this is the experience that I have, what are providers thinking about this, and what is the problem that needs to be fixed? So that's really what prompted me to start paying more attention to that front office operations for medical practices.
Now, with your shoulder, not to bring back painful memories, but was it the shoulder on your dominant arm, or was it the other one? So I could think
It
about
was the
trying to
shoulder.
actually, yeah.
It was the shoulder on the dominant arm. Murphy's Law worked at its best.
Yeah. So you really didn't feel like filling in 1,000 forms and flipping pages over and so on. So I feel for you. I had dislocated my shoulder a long time ago. It was my non-dominant arm, but it was still
Right.
enough. And I can just imagine trying to be wrestling with papers,
Right.
anything like that.
And that's why
Good.
when
Well,
when I came back and interacted with number of providers and medical offices, one thing that ended up being very common was both providers and patients were looking for the same thing, which is ease of use, more efficiency, less paperwork, better interactions with their providers. And that theme was pretty consistent across all the healthcare organizations that I visited. And New York City makes for a great place to do so because you can go visit hundreds of medical offices pretty quickly within a very short zip code. So that's really what prompted us to start Yosi Health, with the goal of addressing the pain points that both patients and providers were facing in the front offices.
got it. And so, what has been the evolution of your product offering? What do you actually offer? What do you do for the for the patient and provider?
As we all know, patients are now informed customers, consumers. They want all the conveniences that they're used to with regards to transparency, convenience, and ease of use. And as a result, COVID has also quantum leaped the patient engagement that needs to be now done in a virtual and remote setting. So what we are doing with Yosi Health is to bring that level of provider and patient communication to patients before, during, and after their journey, by ensuring that providers are giving all of the tools that their patients are demanding now in order to receive the best possible care that they can get from their medical offices. So that results in providing tools like scheduling services for patients to be able to easily book their appointments, being able to communicate and engage with their providers before their appointment, being able to fill out all the medical information so they don't have to spend time sitting in a waiting room like I had to with a dislocated shoulder, being able to make their payments prior to the visit. We're really displacing the waiting rooms as we know it and bringing all of that experience and that care for patients at their convenience to their homes is what we're doing with Yosi Health.
Got it. So, tell me a little bit about the scheduling side of things, because my understanding is that scheduling for a long while, it hasn't been self-service scheduling hasn't been a technical problem. It's been more of a cultural issue about whether the practices want to expose their calendars. What has been your experience, and has that been changing?
Yeah, that's a fantastic question, David. That's really where the challenge lies, because medical offices, while they realize the benefit of patients being able to book their appointments on their own, they also have to deal with a lot of no-shows and patients booking incorrect medical appointments. So while it can be solved with technology, it needs to be done working closely with the medical practices, trying to understand what is that they're trying to solve, what is the pain points that they do not want to handle. So one of the things we've done with Yosi Health is first to make sure that we put a lot of the guardrails in place to ensure the patients don't turn out to be a no-show. That's a massive problem for medical practices because it leads to direct loss in revenue. It throws off the provider schedules where they may not be able to see as many patients and provide the care. So it leads to a lot of cascading problems. So by working closely with medical practices, understanding the type of appointments that they book, how the provider schedules are very dynamic, those are things that we've introduced into our technology solution that ensures that the right patients are booking the appointments at the right time.
Why are there so many patient no-shows? I understand why it's a problem if it occurs, but why are there so many no-shows in the first place?
Yeah, we've done a lot of surveys with patients trying to understand this very issue as to why did you not show up to the appointment. And a lot of it boils down to experience. When they book the appointment, at this time and age, they do have a lot of choices where they can look for other appointments. So what it boiled down to, David, was their experience of not having that interaction with the provider office prior to their appointment. The first time they're speaking with someone is in the waiting room when they meet with the provider. So a lot of times, without that hyper-personalized interaction that they expect, the patients end up not, visiting the medical offices. So one of the things we've done with Yosi Health is how do we create that patient experience right from the point of when they book the appointment so they know they're very engaged with their appointment. If they have to ask a question, they're able to do so with our system. If they need to provide medical information, they can also provide that using our system. So all of that goes towards a patient being fully engaged before their appointment even begins. And what that does is in turn reduces the number of no-shows that may otherwise happen if an appointment is booked and there's no attempt or effort made by the technology solutions used by these medical practices. So that patient journey to us does not begin when the patient steps foot in the waiting room. It begins well before the patient's visit to the medical office. And by enhancing that experience, we've learned a lot in terms of finding ways to help reduce those no-shows for our customers.
I remember a few years ago there was a concept, I think it was called open access scheduling. And what it related to was, the practices were always busy. And when you booked something, it was, many weeks out. And so it wasn't surprising that by the time your appointment came around, you were going to be a no-show because either you got better or maybe, you died or in the hospital or something like that. And the providers, their schedules were full, but, they had a lot of no-shows. How much of the no-show issue is related to that sort of, timing of getting the patient in at the right time? And are things like open access scheduling things that you incorporate?
Absolutely, David. That's a key factor in helping reduce no-shows because that's where the patient journey and that experience in keeping them engaged goes a long way towards making sure that just before the patient's visit, whether it's a week before or 5 days or 4 days before, they're engaged. And we're confirming and making sure that the patients are not going to end up being a no-show. The worst problem for medical practices is if they know the patient is not going to show up, that's okay for them because they can find other patients to fill the schedule. Right. It's when they don't engage the patients, when they do not know whether they're going to show up or not, that leads to a lot more issues for the medical practices. So that's why it needs to be a very hyper-personalized engagement, knowing when to target the patient communication and knowing when to reach out to the patient to obtain the maximum response rate from the patients. So, and that's what we've done through millions of these interactions that we've had with our system, where we're continuously learning to optimize how best to engage patients.
Now I understand why when you talk about the value proposition to the providers, you start with the patient no-shows. Big problem and something that you can do a lot about. The other two, if you could explain a little bit more, that would be helpful too. So one, you alluded to it already, but the payment collection rates, I understand it's an issue, to be able to collect from the patients, not necessarily because they don't want to pay. Talk about that one. And then the other one was interesting to me was about online reputation and SEO. So can you talk about those parts of the value proposition in addition to the patient no-show reduction?
Sure. So these days, patients are finding providers online. More than 65% of the patients that were surveyed were finding providers online rather than, through word of mouth or through other sources. So their online reputation becomes a very key source of patients finding them and finding their medical practices. So all the efforts that they can make these days to enhance that online reputation goes a long way towards them being able to serve more patients. And the first thing we do to help them with enhancing their reputation is first providing their patients with the experience and the care that they would be pleased with. So that goes a long way towards patients writing online reviews and sharing their experiences with other patients that become a very key factor for other patients to find these medical practices. Typically what happens is medical practices do not extend these conveniences to patients. They end up providing a patient with a clipboard in the waiting room. There's no hyper-personalized engagement. And as a result, the patient experience is already pretty poor.
Right.
About 97% of the patients that were surveyed said they did not find problems with the care that they received, but dealing with all of the other administrative aspects of the care and their visit. So our system goes a long way towards first enhancing that experience and then allowing the patients to share their experiences with other patients. So now medical practices that we serve are optimally positioned to extend that experience to their patients and then collect their online reviews and share those experiences with patients online.
And what about the payment collection rates? Why, if somebody working with Yosi Health, are they going to do better on payment collection from the patient?
Sure. Healthcare payments are usually, a mystery for patients either before their visit or after their visit. There's not a lot of transparency in terms of them understanding what they're going to pay or what they need to pay after the visit. So what our system does is by integrating our system directly with the medical record vendors that we work with, we're optimally positioned to find out what the patient side payments are and what is due prior to the patient's visit. So as part of our engagement prior to the patient's appointment, we explain to them how much they're expected to pay prior to the visit. And that allows the patients to know, okay, now this is what I need to pay. I've been told exactly what the breakdown is. And if it's a returning patient or an established patient, we also tell them if there is any outstanding balances or due amount from their previous visit. So it becomes very transparent, clear, and easy for the patients. And as you rightly pointed out, it's not that they don't want to pay. It's that they don't understand if what they're being presented or what they're being asked to pay is correct, accurate, and they can go ahead and pay. Because they're concerned that I don't want to pay for something where I don't need to pay for it.
Right.
So that's the part that we're continually minimizing by making it very clear for the patients that this is exactly why you're paying this much for your visit prior to your appointment. And that once again goes a long way towards reducing that no-show. Because if I've booked my airline ticket, I'm likely to just go ahead and not show up to the airport. I'm going to either try to call the airline and cancel my ticket or end up making my visit to the airport. That's exactly the kind of experiences we're bringing into a patient-provider interaction where we engage them before the visit to make it transparent, to collect all the vital information that we need to collect, and to ensure that a patient understands exactly everything that they need to do before their visit to the doctor's office.
So you've been at it for some years now with Yosi Health. How do you feel about the progress that you've made so far? And what are you looking forward to trying to accomplish next?
Sure, David. So in the last 18 months, we've grown rapidly. We're currently serving about 380 plus customers across 22 different specialties in all 50 states here. And we've served over 15 million patients till date. While our primary focus is working with pediatric care centers, women's health, behavioral health centers, and pain management clinics, we do serve other specialties, and our growth plans involve serving a wider range of these specialties with a strong focus on helping improve patient outcomes. We track patient engagement and the patient data that we're collecting very closely, and there's a lot that we can harness with the data that we've been collecting from the patients. As an example, the opioid crisis, which is something that we all talk about these days, one of the statistics that may have gone unnoticed is that in a consecutive 12-month period, there were over 100,000 deaths due to the overdose crisis. And one of the things we've been focusing on at Yosi Health is how do we identify patients that are at high risk for this opioid abuse? So we partnered with companies to identify these factors, which are not just understanding their health information or health history, but a wide range of socioeconomic factors and other factors that allows us to share that information timely with the medical providers so they can evaluate the risk factors for these patients and help them ensure that the patients are receiving the right care at the right time. So those are some of the initiatives that we're actively working on to ensure that we continue to help improve patient outcomes and not just focus on reducing the cost of care for providers, but truly making an impact in healthcare.
Well, great. Well, we'll have to check back in a few months or years and see how those have rolled out. Let me turn it back to the personal again to close things out and ask you about reading and if there's any books that you've been reading and any books that you would recommend for our listeners.
Sure. One of the things I'm looking to do is to make more time to read more. I do keep up with the industry news and insights and reading about other entrepreneurs. But one of the books I recently reread was Shoe Dog by Phil Knight, just to go back and revisit his experiences and his journey in building the company. And it's a good reminder for myself to also pay attention to the journey and enjoy it while we're building a venture to help solve some of the key problems in healthcare. So that's something that I enjoyed recently.
That's a good one, and he also is somebody that took a journey, physical journey at a fairly young age to a very different part of the world and really saw some insights there. And it was it was rough getting going, but it really made something of it, of course, in the end.
Exactly, and that's what was very inspirational to see that, while looking back, there were some very key moments during his journey that ended up shaping the company. So we take every one of those moments seriously, and we continue to enjoy doing what we do, while at the same time focusing on the bigger picture, which is to solve key problems within healthcare.
Great. Well, all right, Prasad, founder and CEO of Yosi Health, thank you for joining me today on the Health Biz Podcast.
Thank you, David, for having me.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.